Positive psychology in the treatment of depression. So, what is positive psychology? Positive psychology is a method that encompasses giving equal value to the things that are both good and bad in an individual's life. It does not disregard the bad, it simply brings forward that there is good things as well. How does this all tie to the treatment of depression? Treatment of depression. Depression is classified as a feeling of sadness, loss, or anger, which can interfere with a person's daily activities. Both men and women can experience or have experienced at some point in their lives, or maybe many times, depression. The symptoms between men and women are different. Men may experience symptoms related to their mood, such as anger, irritability, anxiousness, emotional well-being, such as feeling empty, sad, behavior such as loss of interest, feeling tired easily, thoughts of suicide, sexual interest such as reduced sexual desire, lack of sexual performance, cognitive abilities such as inability to concentrate, delay responses during conversations, sleep patterns such as insomnia, excessive sleepiness, not sleeping through the night, physical well-being such as fatigue, headache, digestive problems. Some symptoms for women are mood such as irritability, emotional well-being such as feeling sad or empty, anxious, behaviors such as loss of interest in activities, withdrawing from social engagements, thoughts of suicide, sleep patterns such as difficulty sleeping throughout the night, waking early, sleeping too much, physical well-being such as decreased energy, fatigue, changes in appetite, aches, headaches. There are many causes to depression. Some common causes are family history, drug use, early child trauma, and a very common one, medical conditions. Research. Feingold et al. 2019 explored the impact of positive psychology in the treatment of depression by means of meta-analysis using 51 interventions. Interventions can vary in both length of individual session as well as duration of the interventions, weeks to months. This suggests that this treatment can improve the well-being of individuals and is effective at treating depression. Senf and Leo, 2012. Positive interventions focus on developing positive abilities to improve well-being. Focuses on identifying and amplifying one's strength to overcome their weakness. Sin et al. 2009. Showed that individual therapy followed by group-administered positive psychology intervention expected higher benefits even after treatment was over. Research. Hansen, 1998, tested the efficacy of the self-help book, Positive Psychology for Overcoming Depression, Akhtar, 2012, that follows a positive psychology model by comparing it to Reading Well, which follows a CBT-based model. Both depression and well-being were measured at the beginning of the study, right after, and month follow-up. Hansen had 115 participants that had some symptoms of depression but were not being treated. Participants either read the Positive Psychology self-help book or the CBT self-help book for a period of 8 weeks. Results show both groups experienced reduced symptoms of depression as well as an increase in well-being.
Anton et al. The study of Anton et al. Demonstrated that by undergoing a 6-week multi-component positive psychology intervention, it could develop effects on some specific variables like depression and anxiety, as well as many others. There was use of many self-assessment tests, one of them being the Beck Depression Inventory. These results show that specific traits such as depressive symptoms, psychological distress, and anxiety have significantly decreased throughout the course of positive psychology intervention when compared to his control group. This was accomplished by having participants randomly assigned to either the control group, which was a sample size of 43, or the intervention group, which consisted of a sample size of 59. Results show that traits such as depressive symptoms and anxiety had decreased significantly when compared to control group. This can lead up to potential clinical interventions, which can be taken into consideration to make that participants have access to the best programs that met their needs. Gishwin et al. Coming from the study conducted by Gishwin et al., their main focus was on positive themes which participants look forward to, such as finding optimism, strengths, life goals, and meaning, which would do more justice for the patient, as well as making their lives more fulfilled and durable. The participants received 16 sessions of CBT for their major depressive disorder. In order to keep their study balanced, they decided as having a 2 block of 8 sessions each and starting order of the 2 blocks that were randomized. They mentioned the solution-focused therapy, which is aimed fundamentally and reinforcing to bring attention to positive features, both during on sessions and in homework exercises given. By a solution-focused technique, the patient will be concentrated on applying these positive features and elaborate themselves on cognitions as well as behaviors during their better moments. In other words, looking straight at the problem rather than looking at exclusion to the problem. The study includes a comparison of positive cognitive behavior therapy, also known as PCBT, and a traditional cognitive behavior therapy, known as TCBT. PCBT has an incorporation of positive feedback and features, whereas the TCBT was more for treating patients with major depressive disorder. When conducting the PCBT treatment, the therapist focused on concentrating the problems, strengths of the patients, and results of progress aimed toward the goal. The patient's progress was the focal point in exploring the individual's contributions to reflect on better moments and positive outcomes of these moments. Positive psychology exercises were incorporated during sessions and as homework. This included writing about visualizing your best self, making a gratitude list, or just simply by practicing optimistic attribution. TCBT sessions consisted of the therapist using behavioral and cognitive elements per patient. Therapists were encouraged to express their empathy and develop a good working relationship with the patient. This technique avoided having a patient about their moods and using positive psychology exercises. The results came out as having an equal improvement in depressive symptoms throughout the first 8 block sessions, and significantly stronger improvement within this PCBT compared to the TCBT when it came around the second block of session. Overall average, the negative effect was significantly lower during the session of PCBT than during the TCBT, whereas the patients were more in favor in the treatment of PCBT due to their comfort, but not statistically significant, thus resulting with positive cognitive behavior therapy as an effective treatment for major depressive disorder. Santos et al. Santos et al. Demonstrated an objective to conduct a systematic review of the literature by checking the impact of positive emotion in the treatment of depression and usage of strategies of positive psychology, including positive emotions, to treat and minimize symptoms of depression. Their study explains the importance of the relationship between humor and positive emotion and improvement in symptoms of depression by following various strategies of positive psychology. Preventative character of offered enhance well-being and produce elements like resilience and coping resources, which resulted to reduce recurrent relapses for the treatment of depression. These strategies increase of positive emotions, enhance personal strengths such as seeking direction, meaning, and engagement for day-to-day life of patients who are the tools for prophylaxis and treatment of depression. They can be seen as effective to reduce signs and symptoms and provide prevention of relapses. In short, findings of this study are categorized by a range of strategies that are helpful for therapeutic procedures to diminish depression level. Therefore, usage of differentiated strategies hindered a comparative analysis of the effectiveness of treatments. Leyes et al. They believe that in order to have an effective outcome, the reduction of negative emotions should be enforced. One of the techniques within the study mentioned the increase of efficacy in CBT method by exposing and having an orderly focus on the patient's positive mental health and positive emotions. Recent reviews have suggested that in order to have an effective outcome, the reduction of negative emotions should be enforced, and incorporating positive emotions should be the main focus in the treatment of depression. Solano et al. They suggest that the positive psychologists recommended positive interventions as well as helpful for those who are diagnosed with depression. Researchers found that the higher effects for those who are suffering from mild to moderate depression prefer the intermediate bouts of depressive symptoms.
Intervention. We predict that individuals who practice gratitude exercises, reflections, or bibliotherapy will see an improvement in self-esteem and subjective happiness. All while the goal of this intervention is to facilitate the practice of these techniques so they can be performed from home or any other place. We will be able to test the efficacy of these positive psychology exercises by first having the initial client assessment. This assessment acts as a depression screening, which will help participants evaluate their behavior and thoughts and figure out whether they feel that they are suffering from depression. Participants are able to access the screening through a link and learn more about the results. The website used for the screening also offers tips on dealing with depressive symptoms as well. We will then have participants do some positive psychology exercises that can be both accessible and done at home. Due to the current COVID-19 outbreak, we felt it necessary to make the positive psychology exercises this way in order to keep the participants' health as a priority. Finally, participants will fill out a happiness survey. This is meant to determine whether or not the positive psychology exercises were able to help reduce their symptoms of depression. Due to the current COVID-19 outbreak, everyone in the nation has been stuck at home, indoors, which can make things for people who are suffering from depression ultimately worse. It can seem impossible to deal with everything going on and all the while have to deal with the negative thoughts and lack of interest that presents itself every day for someone who has depression. This mental health disorder thrives in conditions such as this, and can even manifest itself further and cause major harm to an individual, such as going into a major depressive episode for a longer period of time, and can even cause some individuals to self-harm. This is why we felt that it was so necessary to make these positive psychology exercises accessible and able to be done remotely from home, as well as providing options that did not require spending a large sum of money, as most Americans currently do not have that luxury. Making these exercises able to be done at home also gives direct access to those suffering from depression the ability to do these exercises and hopefully feel better afterwards. These positive psychology exercises can also act as a substitute for those who are suffering from depression and find themselves unable to find a suitable treatment for any justifiable reason. Or if an individual simply wants to seek a different approach to treatment other than the regular cognitive behavioral therapy, these exercises provide a great opportunity to try out a new approach.
Before an individual can begin a treatment using positive psychology practices, it is important to determine whether or not an individual is suffering from depression or any other mental health disorder. To determine this, many online screening services are accessible through the internet. You can find a reliable source on our wiki page. The link is accessible at the end of the intervention. You will be presented with questions that will help you assess your feelings and thoughts and will ultimately help you determine whether or not you suffer from depression. I will read you some of the questions and pay attention and think about the answers. Over the past 2 weeks, have you often been feeling low in energy, slowed down? Have you been blaming yourself for things? How often have you had a poor appetite? Have you had difficulty falling asleep or staying asleep? Have you been feeling hopeless about the future? Have you been feeling blue? Have you been feeling no interest in things? Have you had feelings of worthlessness? Have you had thoughts about or wanted to end your life? Have you had difficulty concentrating or making decisions? If you answer yes for most of these questions, then you might be eligible to participate in our intervention, and you might see positive results after completing all the exercises. After the survey, you can start the exercises. The first one is gratitude. One of the ways that can help alleviate symptoms of depression is to practice gratitude. One way of accomplishing this is by using a journal to keep and write down at least 5 things we are grateful for every day. These things do not need to be extravagant. It can be as simple as being grateful for food on your plate or having a good show to watch. With this type of exercise, the participant will be able to reflect and demonstrate their appreciation they may think of within their daily lives. Another positive psychology exercise can be to write down what it is that went right in the day rather than focusing on what went wrong, as well as the multiple things that the participants were able to accomplish rather than making a to-do list of things that they have done. This allows for the individuals to see what they have accomplished rather than what has to be done. Additionally, another way to combat depression using positive psychology is by using one of your best strengths in different ways each day for at least a week. An example of this can be shown by curiosity, being one of your strengths. This is just an example. You can do something along the lines of taking a different walking, running route, or trying to cook new foods that you have not had before. This allows for new things to be experienced, which can be amazing and lower your symptoms of depression. Another exercise that can be done remotely and found to be very effective is bibliotherapy. Bibliotherapy is also shown to be a very effective positive psychology exercise when the book follows a positive psychology model, and is a way to combat symptoms of depression. It is also very readily available, being both able to download on any smart device as well as purchase at most bookstores and some grocery stores with the book aisle section. One of these books includes Positive Psychology for Overcoming Depression by Miriam Akhtar. It explains special strategies in order to want to overcome depression and grow as a person in order to avoid the chances of relapsing or for it to reoccur. The book is available via a link posted on our intervention site.
The last thing participants will be completing is the happiness survey. This is used to find out whether or not the positive psychology exercises had an impact. Participants can bubble in a number on a number scale between 1 being strongly disagree and 6 being strongly agree for the given questions. The average score for the happiness survey is about 4 or slightly over. Keep in mind that there are no wrong answers and that the first answer you think of usually ends up being the right one. Results are then sent to the participants' emails once they are able to complete the survey. For those participants that suffer from depression, you can expect your overall well-being to be more improved along with your levels of happiness. We should also take into consideration that the longer the positive psychology interventions are, the greater the gains are produced. Even after this intervention is completed, participants are encouraged to continue on with the exercises despite feeling better. Positive psychology serves as a reminder to ourselves that we can become happy individuals by loving ourselves.